What if high blood pressure is not simply a disease that some people develop, but a predictable consequence of removing from the human diet? The specific plant compounds that the cardiovascular system evolved over millions of years to depend on? The pharmaceutical approach to hypertension works by blocking receptors, inhibiting enzymes, and forcing the cardiovascular system to behave differently than it is currently behaving. The botanical approach works by restoring compounds that the cardiovascular system was designed to receive, and that the modern diet systematically removed. Today I am walking you through 20 plants with documented mechanisms and clinical evidence for blood pressure reduction. Starting with the one that created the entire pharmaceutical antihypertensive industry, a plant whose active compound became the first blood pressure drug ever synthesized, prescribed globally for decades before being replaced by newer options with fewer side effects. And number 3 is a tropical flower, whose clinical trial performance against a standard ACE inhibitor antihypertensive surprised the researchers who designed the study. Stick around because number 6 produces its blood pressure reduction through the exact same molecule that the human body uses naturally, the same molecule that nitroglycerin works by releasing. Number 1. Rauwolfia serpentina, the Indian snake root whose reserpine compound became the first pharmaceutical antihypertensive drug ever introduced into clinical medicine in 1952. Used in Ayurvedic medicine for hypertension and nervous system conditions for 3,000 years, before Western pharmacology isolated its active compound and turned it into a drug that was prescribed globally for decades. The history of pharmaceutical antihypertensive treatment begins with a plant. Rauwolfia serpentina has been used in Ayurvedic medicine for conditions involving nervous system agitation, insomnia, and what traditional practitioners described as conditions of excess heat and pressure, descriptions that map closely onto what we now call hypertension, for approximately 3,000 years. When Western pharmacologists began investigating Indian traditional medicine in the early 20th century, they identified reserpine as the primary active compound. Reserpine depletes catecholamines, norepinephrine, and dopamine from nerve terminals by blocking their storage in vesicles. This reduces sympathetic nervous system tone, lowers heart rate, and reduces peripheral vascular resistance, producing blood pressure reduction. Reserpine was introduced as Serpacil by Cybe Pharmaceuticals in 1952, the first antihypertensive drug ever commercially prescribed. It was used globally for decades before being gradually replaced by drugs with fewer central nervous system side effects. The drug that defined the first era of hypertension treatment, used by millions of patients worldwide, was a pharmaceutical extraction from a plant that Ayurvedic physicians had been prescribing for the same condition for 3,000 years before the first clinical trial existed. The modern pharmaceutical antihypertensive industry was built on the pharmacological confirmation of a traditional botanical observation. Number 2 produces blood pressure reduction through a molecule that the body already manufactures. The plants that contain the highest concentrations of the dietary precursors to this molecule were eliminated from the modern diet, and the rates of hypertension began rising at approximately the same time. Number 2. Beetroot, Beta vulgaris, containing dietary nitrates that the body converts to nitric oxide through bacterial reduction in the mouth and enzymatic conversion in the bloodstream, with nitric oxide producing vasodilation through smooth muscle relaxation through the identical mechanism as nitroglycerin, the cardiac emergency medication, and as sildenafil, with multiple clinical trials confirming systolic blood pressure reductions of 4 to 10 millimeters of mercury. Nitroglycerin has been used for cardiac emergencies since the 19th century. It works by releasing nitric oxide, which activates guanylate cyclase and vascular smooth muscle cells, increasing cyclic GMP, and producing relaxation of the smooth muscle that controls arterial diameter. When arterial smooth muscle relaxes, blood vessels dilate and blood pressure falls. The dietary nitrates in beetroot, the highest concentration of any common vegetable, are converted to nitrite by bacteria on the tongue during chewing, then reduced to nitric oxide in the acidic environment of the stomach and by enzymatic activity in the bloodstream. The vasodilation mechanism is identical to nitroglycerin. Multiple randomized controlled trials have documented systolic blood pressure reductions of 4 to 10 millimeters of mercury following beetroot juice consumption, with effects appearing within hours and sustained with regular consumption. A meta-analysis published in the Journal of Nutrition found consistent blood pressure reduction across multiple trials. Crucially, mouthwash use, which kills the oral bacteria that initiate nitrate conversion, eliminates the blood pressure benefit, confirming the mechanism. The emergency cardiac medication and the root vegetable are working through the same molecule. One was discovered in a laboratory, the other has been growing in gardens for centuries. Number 3. Hibiscus subderiffa, whose anthocyanins and organic acids produce AC inhibition and diuretic effects, with a randomized controlled trial published in the Journal of Human Hypertension, finding that hibiscus tea reduced systolic blood pressure comparably to captopril, a standard ACE inhibitor antihypertensive, in patients with mild to moderate hypertension. ACE inhibitors, angiotensin-converting enzyme inhibitors, are among the most prescribed antihypertensive medications in the world. They work by blocking ACE, the enzyme that converts angiotensin I to angiotensin II, a potent vasoconstrictor. When ACE is inhibited, angiotensin II production falls, blood vessels relax, and blood pressure decreases. The anthocyanins in hibiscus calices, the deep red pigments, have demonstrated ACE-inhibiting activity in laboratory and clinical research. Organic acids in hibiscus, particularly hydroxycitric acid, contribute mild diuretic effects that complement the AC inhibition. A randomized controlled trial published in the Journal of Human Hypertension compared hibiscus tea to captopril, a standard AC inhibitor, in patients with mild to moderate hypertension, and found comparable reductions in blood pressure between the two interventions. A meta-analysis of randomized controlled trials found that hibiscus supplementation significantly reduced both systolic and diastolic blood pressure, with effect sizes in the range of 7 to 8 millimeters of mercury systolic. The vivid crimson tea brewed from hibiscus calices and consumed across West African, Caribbean, and Latin American cultures for generations was producing ACE inhibition through a mechanism that pharmacology would not formally describe until decades after the tea was already being consumed. Number 4. Olive leaf, Olea europaea, whose oleuropein demonstrates ACE-inhibiting activity through the same enzyme pathway targeted by pharmaceutical ACE inhibitor antihypertensives. With a randomized controlled trial finding olive leaf extract produced blood pressure reductions comparable to captopril, while simultaneously providing antioxidant protection for arterial endothelium that pharmaceutical AC inhibitors do not provide. The olive tree has been central to Mediterranean civilization for over 6,000 years. While olive oil attracts most nutritional research attention, the leaves of the same tree contain oleuropein at concentrations significantly higher than the fruit or oil. Oleuropein has demonstrated ACE-inhibiting activity through the same angiotensin-converting enzyme pathway that pharmaceutical ACE inhibitors target, blocking the enzyme that produces the vasoconstricting peptide angiotensin D. A randomized controlled trial comparing olive leaf extract to captopril in patients with stage 1 hypertension found comparable blood pressure reductions between the two interventions, with the olive leaf group experiencing additional improvements in triglycerides and LDL cholesterol that the captopril group did not. Oleuropein also demonstrates antioxidant activity that protects the vascular endothelium from oxidative damage, the damage that contributes to arterial stiffening and long-term cardiovascular risk. The tree, whose branches symbolize peace across 3,000 years of human history, was simultaneously providing the cardiovascular community with a compound that inhibits the same enzyme as the blood pressure medications prescribed to hundreds of millions of patients today. Number 5. Celery seed, Apium graveolens, containing phthalides, particularly 3N-butyl phthalide, that relax arterial smooth muscle through calcium antagonism and reduce stress hormone production in the adrenal glands. Used in Chinese medicine for hypertension for 2,000 years, before the phthalide mechanism was identified by University of Chicago researchers in the 1990s, after a medical student's father reduced his blood pressure by eating celery. The story of how phthalides were identified as blood pressure compounds is one of the more unusual in pharmacological research. A University of Chicago medical student named Quang Lei mentioned to his professor, Dr. William Elliott, that his father had reduced his blood pressure significantly by eating a quarter pound of celery daily after being told he had hypertension. Elliott began investigating, identified 3N-butyl phthalide as the active compound, and published research confirming its blood pressure lowering mechanism. The mechanism involves two separate pathways. Phytholydes relax smooth muscle and arterial walls through calcium antagonism, the same general mechanism as calcium channel blocker antihypertensives. They also reduce the concentration of stress hormones, including epinephrine in the bloodstream, which lowers the sympathetic nervous system contribution to blood pressure elevation. Traditional Chinese medicine had been prescribing celery specifically for hypertension for 2,000 years before Dr. Eliot's research. The mechanism was unknown for 2,000 years. The clinical observation that celery reduced blood pressure was documented consistently enough to be transmitted across 2 millennia of medical practice. A medical student mentioning his father's dietary experiment to a pharmacology professor connected those 2,000 years of observation to a molecular mechanism. Number 6. Dandelion, Taraxacum officinale, producing diuretic effects that reduce blood volume and therefore blood pressure through a mechanism that critically preserves potassium while eliminating excess sodium and water. Contrasting with pharmaceutical diuretics like furosemide that deplete potassium, requiring supplementation that adds cost, complexity, and its own health risks. Pharmaceutical diuretics are among the most commonly prescribed antihypertensive medications. They work by increasing urinary excretion of sodium and water, reducing blood volume, and therefore reducing the pressure that blood exerts on arterial walls. The clinical problem with loop diuretics like furosemide and thiazide diuretics is that they also cause significant potassium excretion, hypokalemia, that can cause muscle weakness, cardiac arrhythmias, and other complications requiring potassium supplementation. Dandelion leaf demonstrates diuretic activity in clinical research. A human pilot study published in the Journal of Alternative and Complementary Medicine confirmed significant increases in urinary frequency and volume following dandelion extract consumption. The mechanism involves compounds in dandelion leaf that increase renal tubular excretion of sodium. While the plant's high potassium content, dandelion leaf is among the highest potassium-containing vegetables, compensates for urinary potassium losses. The result is diuretic blood pressure reduction, without the potassium depletion that requires pharmaceutical management. The weed that homeowners spend significant effort eliminating from their lawns is simultaneously a diuretic that addresses one of the primary side effects of pharmaceutical diuretics, and it grows freely everywhere without prescription or cost. Number 7. Cat's claw, Uncaria tomentosa, whose alkaloids produce endothelial relaxation through mechanisms that include inhibition of platelet aggregation and modulation of inflammatory signaling in the vascular wall. Used by indigenous Amazonian peoples for cardiovascular conditions for generations, and studied in European clinical research for blood pressure and cardiovascular effects. Cat's claw is primarily known in Western herbal medicine for its immune-modulating properties. Its application for blood pressure is almost entirely absent from mainstream natural health discussion, despite a research profile that deserves attention. The pentacyclic oxindole alkaloids in Uncaria tomentosa, pteropodine, isopteropodine, and mitraphyline have demonstrated inhibition of platelet aggregation, which reduces the tendency of platelets to cluster and contribute to the arterial narrowing that elevates blood pressure. The alkaloids also modulate inflammatory signaling in the vascular endothelium, the inner lining of blood vessels whose inflammation is a primary driver of arterial stiffening and hypertension development. European clinical research has studied cat's claw preparations for cardiovascular applications, including blood pressure reduction. Indigenous Peruvian medical traditions have used it specifically for conditions involving the heart and circulation for generations. Knowledge that was encoded in traditional practice long before any pharmacological mechanism existed to explain why it worked for these applications. The Amazonian vine, named for its curved thorns, has a cardiovascular research profile that most Western practitioners who use it for immunity have not encountered. Number 8. Ginger, Zingiber officinale, whose gingerols and shoggols produce calcium channel blocking activity that relaxes arterial smooth muscle through the same calcium antagonism mechanism as pharmaceutical calcium channel blocker. Antihypertensives, including amlodipine and nifedipine, alongside ACE inhibiting activity and prostaglandin inhibition that contribute additional antihypertensive effects. Calcium channel blockers are among the most prescribed antihypertensive medications globally. They work by blocking voltage-gated calcium channels in the smooth muscle cells of arterial walls, preventing calcium influx that would cause smooth muscle contraction and arterial narrowing. When calcium cannot enter smooth muscle cells, the muscle remains relaxed, arteries dilate, and blood pressure falls. Gingerols and shogal, the primary active compounds in ginger, demonstrate calcium channel blocking activity in smooth muscle research, producing arterial relaxation through the same general mechanism as amlodipine and nifedipine. Additionally, ginger has demonstrated ACE inhibiting activity in laboratory research, adding a second antihypertensive mechanism. The prostaglandin inhibition that makes ginger effective for pain and inflammation also reduces prostaglandin-mediated vasoconstriction, a third pathway contributing to blood pressure reduction. A meta-analysis of randomized controlled trials published in Phytotherapy Research found that ginger supplementation significantly reduced both systolic and diastolic blood pressure. The spice that has been used across Asian, Middle Eastern, and Indian medicine for thousands of years for cardiovascular conditions was working through calcium channel antagonism, the mechanism of an entire class of pharmaceutical antihypertensives, before anyone had identified calcium channels as a therapeutic target. If this is showing you that blood pressure management has a botanical dimension that most physicians never discuss, there is a complete practical guide in the first pinned comment below. Everything you need to grow, prepare, and use medicinal plants at home, with step-by-step protocols for the most effective preparations. The knowledge in this video becomes actionable when you have the system to apply it. Link is pinned below. Number 9. Arjuna, Terminalia. Arjuna, the Ayurvedic cardiac herb used continuously for 3,000 years specifically for heart conditions, including what traditional texts described as conditions of the heart's pressure and effort, with clinical trials confirming blood pressure reduction, improved cardiac function, and antioxidant protection of the myocardium, through mechanisms that include calcium channel modulation and glycoside activity. Terminalia arjuna has been the primary cardiac herb in Ayurvedic medicine for approximately 3,000 years, referenced in the Ashtanga Hridayam and Karaka Samhita, the foundational Ayurvedic texts, specifically for conditions of the heart involving exertion, pressure, and irregular rhythm. The traditional applications map closely onto what modern cardiology calls hypertension, heart failure, and cardiac arrhythmia. Clinical research has confirmed blood pressure reduction with Arjuna bark extract administration. The mechanisms include calcium channel modulating activity from glycosidic compounds in the bark, antioxidant protection of cardiac muscle tissue from free radical damage, and positive inotropic effects that improve the efficiency of cardiac contraction. A clinical trial published in the Journal of the Association of Physicians of India found that Arjuna bark extract produced significant reductions in blood pressure alongside improvements in left ventricular function in patients with heart failure. 3,000 years of Ayurvedic cardiac medicine had identified the right plant for the right organ system. The mechanisms that modern cardiology has characterized were producing the clinical outcomes that ancient physicians observed and documented across millennia. Number 10. Motherwort, Licorice cardiaca, whose iridoid glycosides produce cardiac muscle relaxation and reduction in heart rate, used specifically across European and Chinese herbal traditions for the type of hypertension associated with cardiac palpitations, anxiety, and nervous system agitation, a specific subtype of hypertension that most botanical blood pressure discussions ignore entirely. Not all hypertension has the same underlying driver. The blood pressure elevation in a patient with kidney disease, in a patient with arterial stiffening from decades of processed food consumption, and in a patient whose pressure rises specifically in response to anxiety, palpitations, and nervous system overactivation, represents 3 different physiological states that may respond to different interventions. Motherwort has been used specifically for the third type, what traditional European herbalists called nervous heart conditions, and what modern cardiology recognizes as the overlap between anxiety disorders, cardiac arrhythmia, and hypertension. The iridoid glycoside leonorine in motherwort produces negative chronotropic effects, slowing the heart rate, and negative inotropic modulation that reduces the force of excessive cardiac contractions without suppressing normal cardiac function. Chinese and European herbal medicine independently arrived at Licorice cardiaca for palpitation-associated hypertension, a convergence across cultures with no contact that represents the strongest possible empirical evidence for the application. Clinical research has confirmed blood pressure reduction and antiarrhythmic effects with motherwort preparations. The plant, whose Latin name literally means lion-hearted herb for the heart, is addressing the specific cardiovascular profile that most blood pressure discussions treat as a secondary concern. Number 11. Garlic, Allium sativum, whose allicin is metabolized to hydrogen sulfide in the body. And hydrogen sulfide is a gasotransmitter, a signaling gas produced naturally by the vascular endothelium that activates potassium channels in smooth muscle cells, causing hyperpolarization and vasodilation, making garlic the plant that works by donating the body's own vascular signaling molecule. Hydrogen sulfide was identified as a physiological gasotransmitter, a molecule the body produces to signal between cells, in the late 1990s and early 2000s. It is produced by the vascular endothelium and smooth muscle cells and acts as a local vasodilator, activating ATP-sensitive potassium channels in smooth muscle, causing hyperpolarization and muscle relaxation that dilates blood vessels and reduces blood pressure. When allicin from crushed garlic is metabolized in the body, one of the primary metabolic products is hydrogen sulfide, the same molecule that the vascular endothelium produces as a natural vasodilatory signal. Garlic is, in this sense, donating to the cardiovascular system a molecule it already uses to regulate its own tone. Meta-analyses of randomized controlled trials have consistently found that garlic supplementation reduces systolic blood pressure by approximately 8 millimeters of mercury in patients with hypertension. The specific finding that allicin metabolism produces hydrogen sulfide was not made until the early 21st century. The 5,000 years of garlic use for cardiovascular conditions that preceded that discovery were producing hydrogen sulfide signaling in the vascular endothelium, the body's own vasodilatory molecule, without anyone knowing that was what was happening. Number 12. Hawthorn, Crataegus monogena and related species, approved as a pharmaceutical-grade cardiac medication in Germany and several European countries, with dual ACE inhibiting and vasodilatory mechanisms, and a meta-analysis of randomized controlled trials, finding significant blood pressure reduction, alongside improved exercise tolerance and reduced symptoms in patients with heart failure. Hawthorn occupies a unique position among botanical antihypertensives. It is the only plant on this list that has been formally approved as a pharmaceutical-grade cardiac medication by regulatory authorities. In Germany, hawthorn preparations standardized for oligomeric proanthocyanidins and flavonoids are approved medications for declining cardiac performance, a regulatory recognition that reflects the strength of the clinical evidence base. The active compounds produce dual antihypertensive effects. Oligomeric proanthocyanidins demonstrate ACE inhibiting activity, reducing angiotensin II-mediated vasoconstriction. Simultaneously, flavonoid compounds promote endothelial nitric oxide release, producing direct vasodilation. A meta-analysis of randomized controlled trials published in the American Journal of Hypertension found that hawthorn extract produced significant reductions in both systolic and diastolic blood pressure. Additional clinical research has found improvements in exercise tolerance and reduction of symptoms including breathlessness and fatigue in patients with early heart failure. European herbal medicine has used hawthorn for cardiac conditions for centuries. The regulatory approval in Germany represents the endpoint of a process that began with empirical observation and ended with clinical trials rigorous enough to satisfy a pharmaceutical regulatory authority. Number 13. Berberine, from golden seal, barberry, and Oregon grape, demonstrating antihypertensive effects through calcium channel modulation that relaxes arterial smooth muscle, alongside significant improvements in insulin resistance, blood glucose, and lipid profile, addressing the metabolic cluster that drives hypertension in most patients with the condition simultaneously. Hypertension rarely arrives in isolation. The majority of patients with hypertension also have one or more components of metabolic syndrome: insulin resistance, elevated blood glucose, dyslipidemia, and abdominal obesity. A cluster of conditions that share underlying mechanisms and that each independently elevate cardiovascular risk. Berberine addresses this cluster simultaneously in a way that single-mechanism antihypertensives do not. Calcium channel modulating activity relaxes arterial smooth muscle and lowers blood pressure directly. AMPK activation, the same pathway targeted by metformin, the primary pharmaceutical diabetes medication, improves insulin sensitivity and reduces blood glucose. LDL cholesterol reduction has been confirmed in multiple clinical trials at magnitudes comparable to low-dose statin therapy. The combined cardiovascular risk reduction from addressing blood pressure, glucose regulation, and lipid profile simultaneously through a single compound represents a therapeutic profile that the pharmaceutical approach requires multiple medications to approximate. Clinical trials have confirmed berberine's antihypertensive effects specifically, alongside the metabolic improvements that make blood pressure management more durable over time by addressing some of its underlying causes rather than only its manifestation. Number 14. Passion flower, Passiflora incarnata, addressing the nervous system component of hypertension through GABA-A receptor modulation that reduces anxiety-driven sympathetic nervous system activation, targeting the specific mechanism through which psychological stress translates into sustained blood pressure elevation, a pathway that most blood pressure treatments do not address. Stress-induced hypertension is a recognized and clinically significant phenomenon. The sympathetic nervous system, when chronically activated by psychological stress, anxiety, or sleep disruption, maintains elevated levels of circulating catecholamines that increase heart rate, increase cardiac output, and cause arterial vasoconstriction, all of which raise blood pressure. In patients whose hypertension is substantially driven by this stress sympathetic pathway, pharmaceutical calcium channel blockers and AC inhibitors address the downstream effects without touching the upstream cause. Passion flower's flavonoids, particularly chrysin, bind to GABA-A receptors and modulate benzodiazepine binding sites, increasing inhibitory neurotransmission and reducing the neurological excitation that drives sympathetic activation. Clinical trials have confirmed passion flower's anxiolytic effects, and its traditional use across Native American and later European herbal medicine, specifically for nervous system conditions with cardiovascular manifestations, reflects this mechanism. For patients whose blood pressure rises substantially in response to stress, whose readings are dramatically higher at the physician's office than at home, a phenomenon called white coat hypertension, and whose sleep disruption feeds back into blood pressure elevation, addressing the GABA-A system that passion flower modulates represents a more mechanistically appropriate intervention than conventional antihypertensives alone. Number 15. Lavender, Lavandula angustifolia, whose linalool activates the parasympathetic nervous system and reduces sympathetic tone through olfactory limbic pathways, producing measurable reductions in cortisol, heart rate, and blood pressure in clinical studies, addressing the autonomic nervous system imbalance that underlies stress-related hypertension. The autonomic nervous system has two branches: the sympathetic, which activates the fight-or-flight response, raises heart rate, and constricts blood vessels, and the parasympathetic, which promotes rest and digest function, lowers heart rate, and allows arterial dilation. Chronic stress produces chronic sympathetic dominance, a state where the cardiovascular system is perpetually maintained in a degree of activation that keeps blood pressure elevated even in the absence of immediate stressors. Linalool, the primary volatile compound in lavender, activates olfactory receptors that connect through the olfactory bulb to the limbic system, including the amygdala and hypothalamus, which regulate autonomic nervous system tone. Inhalation of linalool has been shown in clinical studies to reduce salivary cortisol, lower heart rate, reduce systolic blood pressure, and shift autonomic balance toward parasympathetic dominance. A randomized controlled trial published in the European Journal of Preventive Cardiology found that lavender aromatherapy significantly reduced blood pressure and heart rate in patients undergoing cardiac catheterization. The mechanism is not sedation. It is autonomic recalibration through olfactory limbic activation of parasympathetic pathways. The most extensively cultivated aromatic plant in human history has been calming the cardiovascular system through a pathway that neuroscience has only recently been able to map in molecular detail. Number 16. Lemon balm, Melissa officinalis, whose rosmarinic acid demonstrates ACE inhibiting activity alongside anxiolytic effects through GABA transaminase inhibition, addressing both the enzymatic blood pressure pathway and the stress-mediated pathway simultaneously, and representing one of the most pharmacologically complete single herbs for stress-related hypertension. Rosmarinic acid, present in high concentrations in lemon balm alongside several other culinary herbs, has demonstrated ACE inhibiting activity in laboratory research, reducing angiotensin II production through the same enzymatic pathway as pharmaceutical ACE inhibitors. Simultaneously, rosmarinic acid inhibits GABA transaminase, the enzyme that breaks down GABA in the nervous system, increasing GABA availability and producing anxiolytic effects that reduce the sympathetic nervous system activation component of blood pressure. This dual mechanism, AC inhibition for the direct vascular component and GABA transaminase inhibition for the stress-mediated neurological component, makes lemon balm pharmacologically interesting for the substantial proportion of hypertensive patients whose pressure has both a vascular and a psychological driver. Clinical studies have confirmed lemon balm's anxiolytic and mood-stabilizing effects. The pleasant citrus-scented herb that grows prolifically in any garden, typically used as a culinary addition to teas and salads, is simultaneously inhibiting the enzyme that pharmaceutical AC inhibitors target and increasing the neurotransmitter that benzodiazepines act on, through completely natural mechanisms from compounds that require no processing beyond making a tea. Number 17. Green tea, Camellia sinensis, whose EGCG epigallocatechin galate improves endothelial function through nitric oxide upregulation, inhibits ACE activity, and reduces oxidative stress in arterial walls. With a meta-analysis of 15 randomized controlled trials confirming significant reductions in both systolic and diastolic blood pressure, the endothelium, the single-cell thick inner lining of every blood vessel, is the primary regulator of vascular tone. When endothelial cells are healthy and functioning optimally, they produce adequate nitric oxide that maintains arterial relaxation, inhibits platelet aggregation, and prevents inflammatory adhesion of immune cells to the arterial wall. When endothelial function is impaired through oxidative stress, inflammation, or aging, nitric oxide production falls, arteries stiffen, and blood pressure rises. EGCG, the primary catechin in green tea, improves endothelial function through multiple mechanisms. It upregulates endothelial nitric oxide synthase, increasing nitric oxide production. It scavenges reactive oxygen species that would otherwise degrade nitric oxide before it can act. And it inhibits ACE activity, reducing angiotensin II-mediated vasoconstriction. A meta-analysis of 15 randomized controlled trials found that green tea consumption produced significant reductions in systolic blood pressure of approximately 2 to 3 millimeters of mercury and diastolic blood pressure of approximately 1 to 2 millimeters of mercury. Modest individual effects that become clinically meaningful with daily consumption over months and years. The tea that has been consumed daily across East Asian cultures for thousands of years, while those cultures maintained historically lower cardiovascular disease rates than Western populations, was working on the vascular endothelium through mechanisms that cardiovascular research has spent decades characterizing. Number 18. Moringa oleifera, the miracle tree of tropical medicine, whose isothiocyanate compounds produce vasodilation, whose extraordinary potassium content supports the sodium-potassium balance essential for blood pressure regulation, and whose antioxidant density rivals the most intensively researched botanical antioxidants. In a plant that grows prolifically in tropical climates and remains largely unknown in Western preventive medicine, Moringa oleifera has attracted research attention across tropical medicine for its nutritional and pharmacological profile. The leaves contain concentrations of potassium, vitamin C, and antioxidants that exceed most commonly consumed vegetables. Potassium is physiologically essential for blood pressure regulation. It promotes renal sodium excretion, counteracting the blood pressure-raising effect of dietary sodium, and it promotes arterial smooth muscle relaxation through effects on cellular membrane potential. The modern Western diet is characterized by simultaneously excessive sodium consumption and inadequate potassium intake, an imbalance that contributes directly to hypertension. Moringa's isothiocyanate compounds demonstrate vasodilatory activity in smooth muscle research. Antioxidant compounds reduce oxidative stress in the arterial wall that contributes to endothelial dysfunction and hypertension. Clinical research from multiple countries in Africa and Asia, where moringa is grown and consumed, has documented blood pressure reduction with moringa leaf supplementation. The tree that tropical traditional medicine has called the miracle tree for generations provides in its leaves a nutritional and pharmacological profile for blood pressure that the Western diet has systematically failed to provide, and that the Western pharmaceutical industry has tried to approximate with multiple medications simultaneously. Number 19. Valeriana officinalis, whose valerianic acid modulates GABA-A receptors to reduce the nervous system hyperactivation that drives stress-mediated hypertension, with additional direct cardiovascular effects including mild calcium channel modulation and reduction of epinephrine-mediated vasoconstriction, targeting the autonomic nervous system component of blood pressure that pharmaceutical antihypertensives typically leave unaddressed. The relationship between sleep quality and blood pressure is well established and clinically significant. Chronic sleep disruption activates the hypothalamic pituitary adrenal axis and the sympathetic nervous system, maintaining elevated cortisol and catecholamine levels that keep blood pressure elevated even during periods when it would otherwise fall. Patients with insomnia have measurably higher average blood pressure than matched controls with adequate sleep. Valerian's GABA-A modulating effects, the mechanism the British government deployed during the Blitz for civilian anxiety, reduce the neurological hyperactivation that disrupts sleep and maintains sympathetic nervous system tone. By improving sleep architecture and reducing the cortisol elevation that poor sleep produces, valerian can lower blood pressure through a pathway that no pharmaceutical antihypertensive addresses, normalizing the overnight hormonal recovery that sleep is supposed to provide. Valerianic acid also demonstrates direct cardiovascular effects, including mild calcium channel modulation and inhibition of epinephrine-mediated smooth muscle contraction. For the significant proportion of hypertensive patients whose blood pressure is driven substantially by sleep disruption and chronic stress activation, addressing the sleep and autonomic component may produce blood pressure reductions that pharmaceutical calcium channel blockers and AC inhibitors cannot achieve alone. Number 20. Flaxseed, Linum usitatissimum, whose alpha-linolenic acid omega-3 content improves arterial elasticity and reduces arterial stiffness. The structural property of blood vessels whose decline with age and poor diet is one of the primary drivers of isolated systolic hypertension in older adults, addressing the vascular aging component of blood pressure that most botanical antihypertensive discussions ignore entirely. Isolated systolic hypertension, where systolic pressure is elevated but diastolic pressure is normal or low, is the most common form of hypertension in people over 60 and represents a specific cardiovascular risk profile driven largely by loss of arterial elasticity. Young, healthy arteries stretch to accommodate the pulse wave of each heartbeat and then recoil, absorbing the pressure peak and releasing it gradually. As arteries stiffen with age, inflammation, and dietary fat accumulation, they lose this elastic buffering capacity. Each heartbeat produces a higher peak systolic pressure because the artery cannot accommodate it. The omega-3 alpha-linolenic acid in flaxseed incorporates into the phospholipid membranes of arterial smooth muscle cells and endothelial cells, increasing membrane fluidity and reducing the structural stiffness that contributes to arterial rigidity. Clinical research has found that flaxseed consumption reduces arterial stiffness measured by pulse wave velocity, the primary clinical measurement of arterial elasticity. A meta-analysis published in the Journal of Nutrition found that flaxseed consumption reduced systolic blood pressure by an average of 2.85 millimeters of mercury, with larger effects in patients with higher baseline blood pressure. The 20 plants on this list work through every major mechanism by which blood pressure can be reduced: ACE inhibition, calcium channel blocking, nitric oxide production, diuresis, autonomic nervous system modulation, endothelial function improvement, and arterial elasticity restoration. Pharmaceutical antihypertensive therapy addresses some of these pathways with multiple medications. These plants address all of them, from a kitchen garden, a tea, a spice rack, and a vegetable. 20 plants, each one addressing blood pressure through a documented mechanism, each one with clinical research confirming what traditional medicine observed. Hypertension affects nearly half of American adults and is the leading modifiable risk factor for cardiovascular disease, stroke, and kidney failure. The pharmaceutical approach manages it. These plants address some of its causes: the ACE enzyme overactivity, the calcium channel dysfunction, the nitric oxide deficiency, the autonomic nervous system imbalance, the arterial stiffening, through mechanisms that evolved alongside the human cardiovascular system, because these compounds were once part of the diet that cardiovascular system evolved to receive. They are not replacements for medical care. They are the botanical dimension of cardiovascular health that most medical appointments never have time to discuss. Hit the like button if this changed how you think about blood pressure. Drop a comment and tell me which plant surprised you most. Subscribe and ring the bell. I will see you in the next one.